thank Oak Street Health and Dr. Khan for being a leader in the community and making this happen today. I'd also like to acknowledge Dr. Rubin, our co-lead of the Cook County Department of Public Health. She and the entire Cook County Department of Health team have done a great job throughout the pandemic, and yet there's a lot of work yet to be done. Now, before I go any further, I've talked about Dr. Rubin, but I should also acknowledge Dr. Khan, who's the Executive Medical Director of Oak Street Health, Dr. Walton, who's Medical Director of Lincoln Crossing Clinic, which is this clinic, and Dr. Stevens, who's Medical Director of the Avalon Park Clinic. It's our goal to vaccinate as many Cook County residents as possible in the days, weeks, and months ahead. This disease has touched us all, young and old, family, friends, loved ones. Dr. Rubin, our co-leader of the Department of Public Health, lost both her parents in the last 2 months to COVID. And last week I wrote a letter of condolence to a member of our staff in the State's Attorney's Office who lost her 18-year-old daughter to the disease. The list goes on. Every day is a matter of life and death for our residents, especially in our communities of color, which have been disproportionately impacted by the pandemic. This is a very important day. We honor Dr. Martin Luther King, a day in which we reflect on justice and equity in our country. We celebrate his life and legacy and continue our commitment to respond to this pandemic each day through an equitable lens. We know many communities have concerns about the vaccine and don't have a great deal of confidence in government. And historically, government hasn't given them reason to be trustful. The county and our public health department are focused on building trust through meeting the needs, hearing the concerns, and answering the questions of all of our residents in all of our populations. Additionally, I'm confident that President-elect Biden's administration will be ramping up vaccine production and distribution in the next few weeks. And particularly, we hope for more vaccines in the communities hit hardest by the pandemic. We know that the vaccination of millions of people in our state and county will take time and patience, and I'm hopeful that we can make progress in the months ahead. Now, the Pfizer and Moderna vaccines have been proven to be safe and effective, and our best chance to get back to some sense of normalcy. And we hope that there are other vaccines that will be approved for distribution in the months ahead. I urge you to get the vaccine. Each and every one of us needs to do that as soon as we're able to, according to local health department guidelines. I know I will be doing so when my turn comes, which I think is next week, thank God. I want to thank you all for attending, and we wish you all a happy and healthy 2021.
So thank you, President Preckwinkle, and I echo your remarks. This is the biggest single project we have undertaken in our lifetimes in Cook County, and it represents an opportunity to earn the trust of every resident. We hold the dreams of Dr. King close, not just today, but as we move through the process of equitable distribution of over 2 million vaccines. To date, about 90,000 vaccine doses have been administered in suburban Cook County, almost 1 out of 5 vaccines in all of Illinois. We are finishing phase 1A, which are the critical healthcare workers. So we're finishing 1A of the vaccination plan, and we will be moving to phase 1B shortly. Phase 1B is a significantly larger population and includes about 375 residents 65 years and older. To meet that need, our community-based network has expanded to 78 sites at which vaccine will be administered this week alone. CCDPH plans to coordinate the vaccination of at least 21,000 residents this week alone, especially with our partners here at Oak Street Health. We plan to open a few large capacity vaccination sites to meet the growing need as well. The biggest factor in our success is the amount of vaccine that is given to us by the federal and state governments. We're working with the state of Illinois to keep them aware of our aggressive plans to administer this vaccine in an equitable, efficient, and safe manner. So on that note, I am so pleased to introduce Dr. Ali Khan, the Executive Medical Director of Oak Street Health. We thank him for hosting this event and allowing us to move through the end of Phase 1A more quickly and moving into Phase 1B. We can't be more grateful for your contributions.
It is a thrill for us at Oak Street Health to be doing this work. My name is Dr. Ali Khan. I am the Executive Medical Director here at Oak Street Health. And we are a network of primary care centers for seniors and for Medicare eligible adults in some of Chicago and Cook County's hardest hit neighborhoods. Here in Chicago Heights, in Bellwood, in Berwyn, in Blue Island, in Oak Park, all communities all across Cook County that have been hardest hit by the COVID-19 pandemic, and patients that we take care of who have suffered disproportionately from this terrible disease. So for us, we are here to serve the needs of the community before us as best we can. We feel, after 1 week of being able to partner with the Department of Public Health and with other agencies to vaccinate 1A healthcare workers across all Cook County, that the need for us to do this work, and all of us to do this work, is absolutely paramount. In just 1 week, we have seen thousands of healthcare workers, 7,500 in total, that have signed up to receive a vaccine from us at Oak Street. These are dentists, home healthcare workers, palliative care nurses, pharmacists, and physicians, all across Cook County, who are looking, searching desperately, coming to us with tears in their eyes, looking to get the protection they need to keep doing the critical, essential work that all of us need to help keep Cook County safe. In just 1 week, we will have vaccinated nearly 3,000 of them. We know, particularly for the communities of color that we serve, that this is not enough. Far too many people are worrying alone, wondering when they will be able to get this protection. And so for both our colleagues that we work with in the community, plus the patients that we are excited to serve in the days ahead, particularly our seniors over the age of 65 in Phase 1B, we need to move for maximal impact as we prepare to scale up for that work. We propose that that work means going fast to vaccinate as many of our peers in the community in 1A as possible, and slow to address the critical vaccine hesitancy that so many of our colleagues fear for reasons that are myriad and justified. It has been a privilege to do this work, and we continue to work arm in arm with Cook County and the Department of Public Health colleagues to make this real.
So my name is Dr. Jasmine Walton, and I work here as a Center Medical Director for Lincoln Crossing in Chicago Heights. I have nothing prepared from you because I wanted to speak from my heart. This matter is absolutely dire. I'm going to tell you from the perspective of a primary care physician who sees patients every day, who expresses their fears and hesitations to me. Please believe when we say we hear you and we understand. This is your opportunity to come and speak to us. Ask us as many questions as you like. There's no question that's stupid or too dumb. We want to hear it all. I want to share a personal story with you if I can. COVID is not just something that exists on the news. It has personally affected my family. Someone who's perfectly healthy, did all the right things, still became afflicted with the disease. And her daughter is a doctor. That being said, I don't want you to treat this as though it's just something that happens in the news. This is something that affects all of our lives. The vaccine, I understand fears and hesitation. I've done my due diligence and my research on my own. It's not new technology, and we would love to walk you through that. It's safe and effective. I got mine 2 days ago. All right, here. And I'm still here. I'm still here. So if I can reach out to everyone, and this is everyone, people of color, majorities, minorities, women, men, all the same, all the time, please reach out to your primary care physician and discuss your fears and reservations with them, because we would be more than happy to talk to you about these things. COVID's not going to go anywhere until we take action. Thank you.
My name is Dr. Kevin Stevens, and I'm the medical director at Avalon Park at Oak Street Health. As a physician on the South Side, I see firsthand the effects that this pandemic has had on our community every day. Unfortunately, I've also seen how it has exacerbated existing health disparities, especially in Black and brown communities. At Oak Street Health, we have worked hard since the beginning of the pandemic to serve the community. At the start, that meant completing wellness checks and delivering food and medications to our patients in need. Since then, I have personally seen the impact of COVID-19 on friends, family, staff, and my patients. However, I want to mention one of the less talked about impacts of COVID-19, its effects on mental health. Every day, I see patients who live in fear because of the virus. I have patients who are scared to get their mammograms and colonoscopies, to see specialists they need to see, and even to go to the ER when they need to. I've seen family members struggle because they cannot visit their loved ones while they're in the hospital. I see seniors battling depression and loneliness because they are living isolated from friends, their church communities, their community centers, their sons, their daughters, and grandchildren. Before the pandemic, our community room was always full with seniors doing activities like line dancing, yoga, and block parties. I miss those times. This COVID vaccine is the start of us getting back to that. I have been surprised by how many of my patients at high risk of COVID-19 complications can't wait to get vaccinated. There are even those who plan to get the COVID-19 vaccine that have declined other vaccines in the past. They want to get it as soon as they can because they know that what this vaccine means for their lives. Of course, there are still many others with real fears and hesitations that we talk through. I would be lying if I didn't admit that I was a little nervous and even a little scared before I got my vaccine. But after personally reviewing the literature, I trust the science, and I've seen far too many consequences from COVID-19. For those of you who are still on the fence, I get it. This is not an easy decision, but it is an important one. If you are scared or nervous, that's okay. Talk to your healthcare provider or someone you know who has gotten the vaccine. We're all in this together. I got my vaccine. I encourage you to get yours to protect yourself, your loved ones, and your community. In honor of Dr. Martin Luther King Jr. Day, I'll end with one of his most famous quotes. Life's most persistent and urgent question is, what are you doing for others?
All right, any questions?
I have a question. So one of the things that I've noticed when the shots are
I'm sorry, could you do me a favor and introduce yourself?
Oh, sorry. Yeah, Jake Griffin with the Daily Herald. Jake Griffin with the Daily
Jake,
Herald.
okay, thank you, Jake.
One of the things I've noticed in administering the shots is that you've got about 2 minutes of acknowledging the possibility of side effects, another 2 minutes of medical history, possibly longer if you're a woman, and then maybe another 2 minutes of prepping the needle and the shot and the arm. And then after the shot's been administered, if you have an allergy history, you're here for 30 minutes under observation, if not 15 minutes. It's a long time to be able to process these shots. Is there a way to cut down on the time consummation or any of the time consumption for the administration of these shots so that you just kind of like plow through them, for lack of a better term?
I think the short answer is not safely, but Dr. Rubin.
Yeah, thank you, President Preckwinkle. Yeah, we can't take shortcuts on this, obviously. I think that there are a couple of ways of making the process as efficient as possible and maintaining people's absolute safety for getting a vaccination. And one is that for individuals that are computer adept, and that isn't everybody, that we're putting in place some online registration pieces so that some of that information is captured ahead of time. So we don't have to register people from scratch when they walk in. We want people to be coming to vaccination sites with appointments already in place. We may have a few events down the line that are walk-in, but the idea is to maintain the appropriate physical distancing and safety within the vaccination facilities so that a registration and an appointment system is key to that. The second thing is that we have as many vaccinators as possible in a particular vaccination site, again, in a safe fashion. So having a big venue where you can have multiple individuals, multiple healthcare providers giving vaccine at the same time. So it's not just 1 or 2 people vaccinating people that are waiting in line. We have people register ahead of time, and we have many vaccinators, or as many as a particular space can accommodate safely.
Doctor, if I'm 65 years old and I'm thinking, oh my goodness, Suburban Cook is moving to 1B, how do I get involved? What should you tell that person? What does that person need to be thinking about right now to ensure that they get their vaccine? And how long could it take before that vaccine is administered?
Well, for perspective, we have over 370,000 residents in suburban Cook County that are 65 years old or older. Now, some of these individuals have already been vaccinated if they are residents of nursing homes, long-term care facilities, but many are not. They're living independently in the community and therefore are not yet vaccinated. So we have hundreds of thousands of just that particular group out of 1B. So what's important is to be a little bit patient. We are rolling out several mass vaccination sites where we can do a lot of people in a single day, as well as working with partners like Oak Street and other federally qualified health centers, ramping up with Jewel Osco and Walgreens and potentially other pharmacy chains that can do vaccination, again, by appointment in the communities where these individuals live. But of course, we are also limited by the amount of vaccine that we're getting. And we don't know on a day-to-day basis how much vaccine to expect pushing out to us, and we get deliveries about once a week from the federal government through the state allocation. So those are the limitations, the vaccination sites and the vaccine. So think about, if we're trying to do as many as, incoming President-elect Biden wants to do 100 million vaccines in 100 days. But we are one state, we are one county within a state. And so that's going to probably take at least 2 months to get through everybody.
Should I be jumping online right now to make sure that I've reserved the space, or is there even a mechanism to handle it?
Over the next week, or the next actually few days, this week, we will be ramping up a more robust registration system. It's not to necessarily sign up for an appointment yet, but it's to get information pushed out to you about when you are eligible and vaccination slots are available for you to then make appointments. And we have a particular site up now at our website at cookcountypublichealth.org, but we are transitioning to a more robust, technically expandable site later this week, and so then people would be able to sign up in a more robust fashion.
How do we register if we don't have the internet?
We are going to be also ramping up a telephone number. I don't have it yet, but we understand that especially many of our seniors have sight issues, have dexterity issues, etc., and need to have a phone number where they can call in order to express their interest in the vaccine, as well as eventually being able to sign up for an appointment. And we will be pushing out that information as soon as we have it in place, but we are working on that also this week so that we will be able to have fully accessible manners for people to get the vaccine.
Question for one of the Oak Street doctors, perhaps. When you get...
I'm sorry, could you tell me who you are?
Oh, Charlie Wojciechowski from Channel 5.
Charlie, okay, thank you. I can't recognize people with their masks on. All right, Charlie, thank you.
When you get a senior who says, I'm really not sure I want to do this or not, what's the first thing you tell them to ease their minds? We all talk about, it's safe, it works, but to get to a senior, to get to their heart and ask and tell them this is okay, what's the first thing you say to them?
Dr. Walton?
Yes, this is my specialty. That's an excellent question. So the first thing when addressing fears of a patient or hesitations is to understand why. So each answer is going to be individually tailored to that person's individual hesitations. For example, we may have, I hear a lot of reference to the Tuskegee Airmen in Miss Evers' voice. So what I usually use in that case is a personal example of I did receive the vaccine myself, and it is safe and effective. That being said, we also have methods where we will explain the science to our patients in terms in which they can understand, which is applicable to themselves, so they are able to make their informed decision. Often reassuring a patient that it's ultimately always your decision, but I want to make sure that you have all the information you need before you say yes or no. Was I able to answer your question?
Yes, ma'am. Another question for Madam President. As we move to this phase 1B, we're going to be doing a lot more people with a lot more, hopefully, vaccines. What are the biggest challenges you see for Suburban Cook as we enter this next phase?
Well, first, we have a significant challenge in terms of quantity of vaccine. You've heard that from our doctors. I was at a press conference with the governor on December 16th, and that was the first week in which shots were available to medical professionals and people who live in nursing homes. And the governor announced at that afternoon press conference that the allocation that the state had gotten was 40% of what they were expecting. And so, not just here in Cook County or Illinois, but across the country, there isn't the volume of vaccine that we need, even for the first cohort, the 1A folks. There's not enough vaccine for 1A, and we're supposed to start with 1B next week. So we have some tremendous challenges with the availability of the vaccine. Vaccine development and availability was one challenge that the country faced. The second challenge is distribution, so distribution logistics. And unfortunately, what I've heard is that the Trump administration has not been fully forthcoming with Biden-elect's team about where we are in terms of distribution strategies and plans, so that's a real challenge. So vaccine development availability, we did well in the development. The availability continues to be a challenge. Transportation, distribution, and logistics is a challenge. And the third challenge, it seems to me, which we don't talk about very much, is we need basically to provide testing more broadly to people. And we need easier tests. I mean, I understand they're using the saliva test at the University of Illinois in Champaign. I mean, basically we should have sort of free testing for people. Anytime anybody feels a little bit not well, that they have access to a free test. And actually, if we could give them away in our pharmacies, it'd be wonderful. But anyway, free test, so that they know to quarantine themselves, know that they're really ill, and take the appropriate precautions. So we don't have sufficient vaccine. We don't have a transportation, distribution, and logistics plan in place, and we don't have really easy free tests available to people. So that, unfortunately, in my view, is going to extend the duration in which we're having to deal with this pandemic, and of course the dire health and economic consequences that result.
Given the,
Is there anybody else who wants to speak to that? Now that I've provided a sober assessment of where we are? Yeah.
well, given those challenges, have you given any thought to reordering the priorities of distribution? In terms of, as you move to 1B, moving certain classes up, first responders, maybe moving people
They're
like
essential
inmates
workers.
down.
1B is people over 65 and essential workers, which includes our first responders. Dr. Speak to this, Dr. Rubin.
The federal government with the CDC, as well as the immunization, the Association on the I forgot exactly, ACIP, they put out very specific and very thought through evidence-based guidance about our tiers and our phases of vaccine rollout. And 1B doesn't just include those above 65, it includes the first responders that are not direct medical providers like our EMTs and paramedics, who are actually 1A, and they're being vaccinated right now. Well, 1B includes our firefighters and our police and security that are not also EMTs. And so they are up next. Also, a very large sector of the so-called essential workforce or critical infrastructure workers are also in 1B, and the rest of them are in 1C. So we are getting to what we think are really the highest priority groups next coming up. I mean, I think that it's a very rational plan, and at this point there's no plan to change around that kind of a schema or a prioritization. It maybe will be allowed to do some tweaking, but we also, in order to receive the vaccine from the federal government, we also have to abide by these guidelines.
I got a couple questions about how we're making sure that the right people are getting the vaccine properly currently. So what is the protocol currently, and what will happen in 1B for essential workers and firefighters and older adults and stuff, to prove that they are in fact eligible for the vaccine at that time? Do I bring in my ID from Julasco saying I'm a employee of a grocery store or a firefighter? What'll be the protocol, and what's happening now with like dentists and you know, palliative care folks that are getting them, the non-affiliated folks?
Yeah, no, that's a good question. For the 1A category, for those individuals that we call unaffiliated medical workers or healthcare workers, so those that don't work with large hospital systems where they're getting vaccine as part of their job, and they know who you are, you show your ID, they have ways of knowing exactly who their employees are. but for people who work as home health care workers, people that work as physicians or dentists or physical therapists in their own practices, that we do expect them to have some proof of some sort, whether that's an ID, whether it's a copy of a state license, whether it's a business card. But the goal is to get as many shots into as many arms as quickly as we possibly can in a safe and equitable manner. That being said, if somebody says, I'm a dental hygienist and you can see I'm wearing my scrubs, but boy, I forgot my ID today, we're not going to turn anybody away. So, and as we go into 1B, where it is people who are not, we're not only looking at workers, we're also looking at our older population. If somebody comes in, I can understand, you know, I can tell you a story with my parents who just passed away. They were in their 90s. About 4 years ago, you know, they were no longer driving, which was a good thing. But they needed state IDs because their driver's licenses had expired. You can't imagine what it took to get them to find their passports and to get all the documentation together, and I was helping them do that, so I could take them to the Secretary of State so that they could wait in line and get their state IDs. So I can't imagine how many seniors out there that didn't have somebody like me or my sister or brother who could take them to do this. So there are a lot of folks out there that don't have IDs that say that they're 65 or older. We are going to trust you. Right? But we do expect that if you do have some sort of identification, to please exhibit that to us. But we are not going to turn people away.
And should I be?
Last question, please.
I'm sorry. Should I be registering in my home county where I live or where I work, or should I register in both?
I would choose one or the other.
Okay.
We are taking anybody who lives or works in Cook County. And frankly, if somebody lives in Lake County and they say they work in Cook or they live on the border between Cook and Lake, that's fine, we're going to vaccinate you. And there's reciprocity. There's reciprocity with the city and us, with the collar counties and our county, because we all know that borders are not really defining where your contact is and where your movements are. And we want everybody to be vaccinated.